Some people have no symptoms or very mild symptoms, and other people react very severely. And it really depends on your body's immune system and antibodies that it's trying to create against the virus. I would recommend that you stay home and avoid public areas to avoid spreading the disease. Most people with COVID have very mild symptoms and can recover at home without any hospitalizations. Again, remember to monitor your symptoms. You can journal it and keep a record of it for your doctor to let them know. I do want to emphasize that if you do start developing any of the following symptoms, such as if you're having trouble breathing, if you're having persistent pain or pressure in the chest, if you start getting confused or you're becoming very difficult to wake up, please do seek emergency care in the emergency department and don't delay your care. While you're at home recovering, remember to take a lot of time and rest and just take it easy. Get lots of sleep, and you can take any over-the-counter medications as needed. I think generally when you're sick with any type of respiratory virus, you want to eat foods that are highly nutritious. So I would avoid greasy foods, difficult to digest foods, as common symptoms of COVID can include nausea and diarrhea. So you want to eat something easily to digest. I always recommend something like chicken broth, homemade if possible, bananas, fruits, vegetables. Those food items contain lots of vitamins and minerals and are very easy to digest on your stomach. The COVID-19 or coronavirus is a virus. So if you look at other types of viruses that you might contract before the pandemic, some people react very differently. Some people have no symptoms or very mild symptoms, and other people react very severely. And it really depends on your body's immune system and antibodies that it's trying to create against the virus. Yes, that is a great question. I would recommend you still get the vaccine even if you had the disease. The recommendation is to wait a couple of months. I believe it's 3 months after improvement. Some people are recommending just waiting 2 weeks after your symptoms have gone away. I think that's going to be a little bit different for everyone, and it will be a personal choice to make. I would recommend you discuss that with your primary care doctor on when would be a good time for you to get the vaccine. We're seeing a lot of neurological symptoms develop, and again, taste and smell does have to do with some of your cranial nerves. And so other neurological symptoms, for example, confusion, decreased ability to concentrate. Some people are even getting numbness and tingling in certain body parts and limbs. We assume that the virus has affected the neurons in the body in some way. Is that permanent? I think right now it's unsure whether it is or not. When neurons are damaged, generally they are able to recover. Sometimes it can take a really long time. So I wonder if some of those people, if it's still in the recovery process, that they might one day get their taste or sense of smell back. I think that's hard to say for certain. As schools begin to open, you're going to be more concerned about children being together in closed spaces or students being together in closed spaces. As much as you can, practice the good hand hygiene recommendations I had recommended. Make sure you're always wearing masks and remind your child to try to social distance as much as possible and limit the spread of that disease. And again, if your child is showing symptoms, get tested for it, monitor their symptoms, and try to isolate in one room to limit that spread to the other people in the family and protect those at risk.